Joining us to talk about that is Bob Gaydos, the Corporate Strategy Advisor with Kashable. Bob, good morning.
Good morning. How are you guys?
Hey, we're great. How are you doing?
Doing great. Down in sunny Florida, so I got to be doing great.
Ah, there you are. I know you spend time. That's fantastic. Hey, Bob, for the audience that might not know about Kashable, give us a little background on Kashable, please.
Well, Kashable, what we're doing is providing socially responsible loans to employees. I never really realized the problem until I got involved with Kashable, and maybe I just had forgotten. Okay, I'll tell you a little story. So, just last week, I'm in Ambler, Pennsylvania. I'm at a coffee shop. I'm with a colleague, and I start talking about this problem. And I say out loud while I'm sitting in the coffee shop that 1/3 of the U.S. workers have less than $1,000 in liquid savings. And a guy in the coffee line turns to me and actually says out loud, "Yeah, I'm one of those guys." And it made me remember. Yeah, exactly. And I realized I had forgotten. I had forgotten the early days of my marriage, 2 kids, mac and cheese night. Thank God it's Friday night TV where we just eat mac and cheese. I had forgotten that. We have, a whole segment of the American working population, well over 1/3, close to a half. They're living paycheck to paycheck. They don't have retirement savings, and they also have poor credit. And what Kashable does is solves that. Okay, what we're able to do, because we have access to information. They're on the payroll system, right? They're on the benefit administration system. So since we're hooked up to that, we know their date of hire, we know their wage, we know their paycheck, we have a payroll slot, and we can give them a socially responsible loan, meaning a good interest rate, not a, super high paycheck, loan, payday loan. A responsible 6 to 15%, 6 to 20%, depending on their credit rating loan, and they can pay us back through their paycheck, and they have to pay us back through that because it's a payroll slot. So it's a very social, responsible way to take care of the fact that they're living paycheck to paycheck. Now, this is the most important thing. At the exact moment when we keep giving them higher and higher deductibles, right? Yep. And what's interesting is when you study the demographics, you see that the lower the wage by an employer, the lower their employer contribution to the health plan, and the higher the deductible. So we're actually just making the problem worse. So what we're doing is solving that problem.
So if an employee has credit challenges, that's kind of removed from the equation because you're connected with that employer, and
that's right.
Okay, that's great. And
now go ahead.
No, go ahead, Bob. Go ahead. I didn't mean to interrupt you.
Well, here's another problem I never realized. I mean, again, I just had forgotten. Like 1/3 of America has a credit score less than 620. So where are they going to go to get a loan? They're not going to go to the bank, or they're going to get some really high interest rate. And we solve that problem.
Yeah, this is, there's other solutions out there that help address credit problems to buy stuff. I don't mean to de-emphasize, any of those companies that are doing that, but your Kashable is here to help employees and their families address a serious problem, and that is a healthcare challenge, healthcare cost challenge.
That's right. Now, look, they can also take the loan to pay for the car repair. They can also take the loan to pay for the refrigerator that just broke, okay? But because we're going to be part of that benefit program, we're able to help focus on a really immediate problem they have, which is, okay, now I owe somebody $1,500 for that doctor. How am I going to pay that doctor?
So is the loan paid back on a pre-tax basis? Payroll deduction?
No, it's not paid on. It's paid payroll deduction, but it wouldn't be pre-tax. No.
Yeah. Okay.
But it is a payroll deduction loan, and it's similar to a mortgage loan, not like a credit report. You can't do a minimum payment. One of the problems with your credit cards is you can get away with a minimum payment, so they're paying it back, and the interest payment ends up being very low.
Yep. I mean, I can understand. I think I understand what would motivate an employer to do this, particularly those that are socially responsible themselves. And it's a great retention tool too for your employees. What is keeping employers from embracing this? I know you're very early, so that right now. But what would keep an employer from embracing this?
Well, usually the first fear an employer has is that they believe they're on the loan for the hook, and they're not. Or they're on the hook for the loan. This is a loan for the employees. There was some past programs where the employer had to take the risk on that loan. The employer has no risk. So a lot of times it's just helping them understand two things. You are not on the risk of this loan. This is the employee's loan. Okay? And number two is, a lot of times they don't understand the same thing I didn't understand. They don't really understand how big the problem is. They don't really understand the low savings. They don't really understand the credit score challenges that a bunch of people have. Okay? Once they do those two things, then suddenly it starts to make sense to them. Because they also, look, I think employers care. I've been doing this for 25 years. These employers care about their employees. They care about these programs. And they understand a problem that they're doing, which is every year they keep increasing these deductibles. And they also understand it doesn't actually make sense to buy a low deductible plan because 70% of their people don't need it. So eventually the light goes off, and they're going, oh, this does make sense. Okay, why would I buy in a lower deductible? I can't afford to give it to them. They can't afford to pay for it. They probably don't need it. This solves that problem after the fact, which is a far more responsible way to do it. And I don't have to become a bank, right, which is what they shouldn't be, is a bank.
Right. Bob, this is Ron Bachman here. At the Institute for Healthcare Consumerism, we like to promote choices of all types, let employees make choices. Now, the thing we've been talking about for a long time is account-based plans with the accumulation of funds to cover the kinds of costs you're talking about, so the people are doing it in advance, building up an HSA account by putting in pre-tax dollars. But the part of the market that sounds like you're approaching are those people who can't even afford to do that. Maybe the employer isn't putting much, if anything, in there. So when they have an expense, now they've got to figure out how to pay for it. They haven't prepared in advance for it. So you're giving them a new option maybe that wasn't available before. When they do this, you're doing it because they're working, they're employed. What if they're not paying with their, I assume you're taking it out of their salary periodically. Is it a garnishment of wages? Is there a legal requirement? What's the situation that you're putting employees in order to get this loan and to repay it?
Well, there's really two things here. Number one is we have access to the information, and we can see more than a bank can see because we know when they were hired, how much they make, what the payroll, what their payroll date is, what their net paycheck is. We know all that. And the second thing is we have access to the payroll slot. That's the key. Okay, so they're signing a document that says they agree to pay us back, and they agree to pay us back on that payroll slot. That's really the key. I mean, look, employees love payroll deductions. They love the convenience of it. So in a way, this is actually more convenient than anything else they could do. Okay, great. I'll do this loan over 6 months, take $40 a paycheck out, and I'll pay it back. They're used to that. They find that very convenient. Now, one of the things you talked about a little bit earlier there is the account basis, whether it's, say, an HSA. If they actually do have access to an HSA, they could actually make it work through the HSA. Because one of the problems that lower income people have with the HSAs is that, maybe they have the discipline to put $10 a week in there, but what happens if they have a $500 expense in month one? Well, they could actually come to Kashable, take out the loan, and on the tax return, put money into that HSA. It actually ends up looking as if you actually ran, a tax-free payment to the medical provider.
So is the loan that you're giving out, is it a fixed amount? Is there a cap on what it is? Is it related to the plan deductible? Is it a credit card, or do they actually get cash? How does this all work for our listeners out there that are hearing about a new option?
Well, the loan is going to be related to their income. So how much they're allowed to loan will be related to their income. Now, one of the things we're seeing in much early data is they come back. Okay, they might take out a $1,000 loan and 6 months later need it again and come back and do it again. But it's related to their income. Obviously, the higher the income they have, the higher the loan we can give them. It's not a credit card, and it is a straight out, amortized loan over a 6 month or 1 year period, and they're paying it back out of that paycheck.
Well, we know a lot of employees turn over fairly rapidly, especially in small companies, low income, find another job. What happens if somebody leaves employment? What happens to that loan, and how do you collect on it?
Well, that's our responsibility at Kashable to collect from them. So when they're they're going online. This is a very quick, easy online process. So they're going to go online. We know who they are because we have the data from the system. Okay, we're going to recognize them, ask them a few questions, and then based on that data, we're going to give them that loan, and they're going to have that money in 72 hours, and then they're going to pay us back. If they leave employment, we have the information. They gave us their phone numbers and their addresses and all of that, and they're going to pay us directly. The employer does not have anything to do with that.
Does the interest rate change at that point in time?
No, the interest rate does not change. No.
So there's no difference in the characteristics of the loan. Just now, instead of coming directly out of that payroll slot that you described, now they're personally responsible for making those payments.
Correct.
Okay. Hey, Bob, what's the Kashable's business model?
The business model is quite simple. We're just trying to get access to these employees in many different ways, whether that be the employers through the brokers, or whether that be any employers through systems like perhaps HSA, FSA companies, or whether that be access through medical TPAs. And through that access, those systems that give us a loan are paid a little bit of money for access, and that's really it. It's really quite simple. We're just trying to get onto the system, whether it be a private exchange, whether it be a medical TPA, whether it be a broker promoting, make it available. There's no cost to the employer. There's no cost to the broker, okay? The interest is charged, and we earn revenue, and a little bit of revenue is paid to whoever put us on the system. So it's really quite simple.
So as you're putting this together, you indicated earlier that the employee could go out and do anything with the money. It's not just for health care, although that's
right.
We know one of the main reasons for bankruptcies and people getting in trouble are these high health care costs that come along with the high deductible plan. Now the individual has to pay for it. What kind of concerns are you hearing from employers that say, yeah, I want my employee to be able to cover health care costs. I want them here on the job healthy and productive. And if they take out a loan to go buy a bass boat, now their ability to actually cover health care costs is that much less, and they're not going to take care of themselves. How are you addressing that, or do you get feedback or pushback from your program along those lines?
Well, I think that certainly that conversation will be had, and employers are going to have that thought. But at some point, employers have to realize, I'm going to use the old Mike Ditka line. Mike Ditka, when he was coaching, said, you get what you tolerate. You would never get involved in their mortgage loan. You would never get involved in their credit card loan. Why are you getting involved in this? They are responsible human beings who live good lives. You're just giving them access, okay? You're not going to stop people from making bad decisions, okay? But you are the access point. And without you, they don't have the access. So, yes, we all care about our employees, but at some point, we have to let them be adults. And we can't be judging whether or not it's correct for them to take the loan for the refrigerator versus take the loan for the deductible, okay? But what we can do is make sure that they have access. And without this, they don't have access. And that's really probably the most important thing that the employer should care about. So really it's just about helping the employer focus on what is important, what they can influence, what they can't influence.
So is that where your term, you call it socially responsible credit? Is that what you're really referring to, is that we're allowing credit to reach more people that otherwise wouldn't have access to it?
Yes, and even more importantly, at affordable rates, okay? The fact is that there's another thing that makes this more socially responsible. This is less expensive in most cases than taking a loan from your 401k. And if you took the loan from your 401k, you're actually rating your retirement account. So it would be better and more socially responsible for you, the employer, to let them have access to this than let them keep going to the 401k loan. Because, most 401k loans are not paid back. Most have policy fees, which actually make the interest rate significantly higher. Okay? That's not a good thing. So it's much more socially responsible to give them access because what is their big asset? Their asset is their job. That's their asset.
Right.
So let them use that job asset to get the loan. Let them pay back correctly that way. Have them avoid payday loans. Have them evade 401k loans. That's far more socially responsible, and we're doing it at very affordable interest rates.
So how is this better or different from just going out and getting another credit card?
Well, I would actually argue it's more socially responsible there because one of the weaknesses of a credit card, and I have 4 adult children, I think I did a good job of training them on this because, unfortunately, I did not learn this, which is the problem with the credit card is the minimum payments. You take $1,000 out of your credit card, they're charging you high interest rates, higher than we're going to charge, and I can make a minimum payment, which means over time my interest dollar was really high. So, again, we would argue this is far more socially responsible than just telling them to go to their credit cards.
Okay. Bob, listen, we really enjoyed having you on the program, and to our listeners out there, you can come visit Bob at IHC Forum West. He'll be with us out in Las Vegas. participating at IAC Forum West. Bob, tell our audience how they can get in touch with the team at Kashables, and then leave us with some parting comments, if you would, please.
Kashable.com. Okay.
There you go.
To Kashable.com.
Okay.
And I will leave you with one parting comment. Earlier you were talking about the Cadillac tax. This is a very good way to deal with the Cadillac tax. We're all being put in a situation where there's money being counted in the Cadillac tax. Offering somebody an affordable loan is not counting in that. So I think this is one very important component to consider as employers plan. What do I do in the future to deal with the Cadillac tax?
Okay, good point.
Thank you, Bob. We'll see you soon out in Las Vegas. Enjoyed having you on the program,
Great.
as always. Take care.
Thanks, Doug. Thanks, Ronnie.